But as you said, a lot of people who do have arthritis, the main kind of thing that they deal with or have to kind of suffer with almost is the pain of it on a day-to-day basis. How does PEMF actually then reduce the pain kind of for these people?
So the main reasons for pain with patients with arthritis is that a lot of the time they have increased inflammation in those joints, but they also have a reduction of cartilage in the joint. So arthritis can be defined through scans when they look at the knee, for example, and over years the cartilage has worn away. And the pain can be caused a lot of the time by the bones almost grinding together. So it's not a nice disease to have and not a nice symptom. So PEMF therapy is one of a small amount of therapies that has actually been shown to rebuild cartilage. And what we say by rebuilding cartilage is not as if the PEMF therapy is going in there and it's creating cartilage. Like we mentioned before, PEMF therapy is working on the body to create an ultimate environment in the body to heal. So if you're creating that environment in the body to heal, your body is having time to repair that area, and it's repairing the cartilage, rebuilding the cartilage in that area. So with an increase of cartilage, that's the lubricant between the two joints. That's ultimately going to reduce pain over time.
Yeah, that's really interesting you say that as well, because in episode 10, where we had Jess Clark on, who was an ex-pro footballer, she actually spoke about her knee injury, and that was kind of one of the biggest things that happened for her. She was bone on bone, had no cartilage there, obviously started using PEMF and ended up being able to actually start to play football again. Really interesting episode if you haven't listened to that already.